Today I am going to talk about the specialized diet which a hemodialysis patient should be taking. All patients of end-stage renal disease are on hemodialysis can achieve a good dialysis outcome if they carefully monitor their diet in order to control the fluid intake in the body as well as to control the generation of waste products in the body. First and foremost is the protein. Patients on hemodialysis should have a high protein intake. They should be taking around 1.2 gram per kg body weight of proteins in a day, especially proteins which have high biological value, that is animal proteins. So I would suggest patients to eat good quantity of chicken, fish, poultry and egg in a day. For vegetarians, I would suggest paneer and beans will help to maintain their muscle mass, help to maintain their immunity and ensure long lasting health on hemodialysis. Coming to potassium, any patient on hemodialysis has reduced ability to excrete potassium out of their body. So potassium intake has to be restricted. One should avoid fruits, especially citrus and orange fruits. Fruits such as apple, papaya and guava relatively contain a lower quantity of potassium and can be taken and are often suggested by nephrologists. One should avoid intake of tomato and vegetable soups. One should also avoid intake of coconut water as well as green leafy vegetables, dry fruits and other raw tomato cooked items. Cooking vegetables as well as peeling off vegetables will help to reduce the potassium quantity in these substances. Hemodialysis patients should also reduce their phosphorus intake. So I would tell them to avoid milk and other various kind of milk products such as curd and cheese. They should avoid intake of bean products. They should avoid chocolates. They should avoid Coca-Cola. They should avoid meats. Taking excess quantity of phosphorus will cause hardening of their vessel by causing deposition of phosphates in the vessels and also increase the tendency of itching. Thus, it is very important to reduce phosphorus levels, which has a tendency to rise in end-stage renal disease patients. Next, they should also concentrate on reducing the sodium intake. So one should avoid using table salt, avoid using any chaat, pickle, chutney, any kind of masalas, avoid your salty wafers, salty popcorns, avoid any tinned, canned or preserved food items. Such things will cause an increased retention of sodium in the body, thus increasing to fluid retention and can often precipitate pulmonary edema, which presents as breathlessness in dialysis patients. Other than that, they should also have a strict check on their fluid intake. Usually, patients who are on hemodialysis have a reduced urine output which is less than 1 liter in 24 hours. So one should avoid intake of all kinds of fluids including water, milk, tea, coffee, soups and so on. Also, patients on hemodialysis have an increased tendency of having anemia. So iron is a very important supplement that should be provided to such patients. I would suggest iron fortified cereals, chicken, lima, kidney beans and so on. Also, patients on hemodialysis require vitamin supplementations, especially the water soluble vitamins such as B and C, and in certain cases fat soluble vitamins such as vitamin D. So excess supplementation of these vitamins might be required depending upon their levels that are there in the body. Thank you.